I'm Julietta Patnick, and until very recently I was Director of Cancer Screening for the NHS in England. I had an open mind, and I took opportunities when they presented themselves. I didn't believe, and I still don't believe, that people can become scientists only if they don't read anything, nor do I think that people who are interested in literature and history and the arts are incapable of understanding sciences and numerate disciplines. I became an NHS planner, and I had to improve my numeracy skills, so I went off and did some courses in statistics. That's how I started, and then I ended up planning the breast screening programme in one region of England, and then it became the breast screening programme nationally, and then from breast screening into other forms of cancer screening. So it was one step at a time, but I think I didn't let myself be confined by being an arts person and not a sciences person, and as long as I did the job, other people were responsive to that. It was a very interesting and challenging job. In England we have, and indeed in Scotland, we have 3 big cancer screening programmes, one for breast cancer, one which is for women over 50, one for bowel cancer, which is for men and women from their 50s onwards, and one for cervical cancer, which is for women from 25 onwards. And these days, teenagers are vaccinated against HPV, which protects them against 3/4 of cervical cancers. There's still 25% of cervical cancers out there, and older women who are now 25 and above, the vaccination wasn't available for them at the right age. So we'll be screening for quite a long time yet, and altogether in England, those screening programmes carried out about 8 million screening episodes a year. So somebody has to make sure that that happens, and happens as well as it possibly can, so that we do the most good and the least harm. And that's what I did. Well, cancer is something going wrong in the DNA of a cell. Cells have a programmed life cycle. And all of us sitting here, me talking, people listening, don't have the same cells that they had when they started, because it's constantly renewing. And with all these thousands and thousands of cells constantly renewing, obviously sometimes things go wrong. And the body has a way of checking that the cell is right, and if it's wrong, killing it off. And in cancer, that mechanism goes wrong. So faulty cells don't die off, and sometimes they can get bigger, replicate themselves, and you have, before you know where you are, you can have a whole lump full of faulty, nasty cells that go on to wreak havoc in the body. Now, what causes that process, that DNA to go wrong? That can be all sorts of things. If you smoke, that damages the cells, and that's the worst thing you can do for your health. So if you only do one thing, it's don't smoke. But, for example, going in the sunshine without protection when it's very hot, coming back burnt red and peeling, that damages the cells of the skin. So different things can cause the cell to go wrong, but essentially it's the cell going wrong and not dying off. That's the cancer. Well, the big benefit is that it prevents people dying of whatever cancer it is you've screened for. Or if a cancer is found early, the treatment can be easier. There are 1 or 2 kinds of cancer screening that can actually prevent cancer by removing abnormal cells before they've turned into cancer. Disadvantages are, first of all, as soon as you send somebody a letter saying, please come for cancer screening, they think, oh, whereas normally most of us don't think about it. Suddenly a letter arrives and you have to think about it. You have to go along. Sometimes, some tests you can do at home. The tests can be more or less unpleasant. Most of us would not say our favourite afternoon is having cancer screening. Not that bad, but you know, I've got better things to do with my afternoons. I'm sure lots of other people have too. The complicated answer is that sometimes cancers are found which will never kill you, and that's difficult to get your head round, because people tend to think that if you have cancer and it's not treated, you will die of it. And actually that's not always the case. And so we go screening and we find lumps and bumps, and then we say, oh, you've got a bump that you didn't know about, something, a little focus of abnormal cells somewhere in your body, and that we've just screened, and we would like to offer you treatment. You can have them cut out. And then you've got a dilemma. Do you have it treated? Don't you have it treated? Whereas you never knew it was there, it wasn't causing you any trouble, and it might never cause you trouble. The big problem is we don't know which are the killer cancers and which aren't. Which are the abnormalities that will go on to be cancer, and which ones will sit there forever or even go away on their own. Nobody knows that yet, and that's the big downside of cancer.
4 cups of coffee per day for a healthy adult is okay. It's not bad.